Today I want to talk about something that almost everyone notices at some point, neck aging, and specifically why it happens, what causes it, and how we actually fix it in a way that looks natural. The skin is one of the first areas that can give away age, even when the rest of the face still looks youthful. Many patients come in and say, my face looks fine, but my neck is what bothers me, or I feel like my neck makes me look older than I am. And that's a very real concern because the neck changes can be hard to camouflage, and they show up in photos, in profile, and even in video. So the first thing I want you to understand is that neck aging is not just one issue. It usually comes from a combination of three things: skin laxity, muscle changes, and fat. And the best treatment depends on which one is causing the problem for you. Let's start with the first cause, skin laxity. As we age, our skin produces less collagen and elastin. Collagen gives skin strength, and elastin gives the ability to bounce back. Over time, the skin becomes thinner and looser, and it doesn't retract the way it used to. This is why some people start to notice crepey skin, wrinkles, or loose folds under the chin and along the neck. Skin laxity can also be influenced by genetics, sun damage, and weight changes. If someone has lost weight, especially significant weight, the neck skin may not tighten back completely. And if someone has a lot of sun exposure over the years, the skin quality can weaken and age faster. Now, if the main issue is mild skin laxity, some non-surgical treatments may help. There are tightening devices and treatments that can simulate collagen and improve firmness slightly in our practice. But I want to be honest, non-surgical treatments have limits. They can help mild cases, but they do not remove excess skin. So if you can pinch a significant amount of loose skin, surgery is often the most reliable way to correct it. The second cause of neck aging is muscle changes, specifically something called the platysma muscle. The platysma is a thin muscle that runs down the neck. As we age, the edges of this muscle can separate and become more visible. That's what creates those vertical neck bands that some people notice, especially when they talk, smile, or animate their face. Neck bands can make the neck look older even if the skin itself isn't extremely loose. And this is an important point. If the main problem is muscle banding, skin tightening alone won't fix it. You can tighten the skin, but the bands will still show. To treat neck bands effectively, we often need to address the muscle as a part of a neck lift. The third cause of neck aging is fat, especially fat under the chin. Many people call this a double chin, but it can show up in different ways. Some patients have a small pocket of fat under the chin that blurs the jawline. Others have more fullness that creates a heavier neck profile. And I want to emphasize that this is not always related to weight. I see plenty of thin, healthy patients who have some mental fullness. In many cases, it's genetic. When fat under the chin is the main issue and the skin quality is good, liposuction can be a very effective option. It can sharpen the jawline and improve the neck angle significantly. But again, it depends on the skin. If the skin is loose, removing fat alone may not create the tight neck contour you want. You may still have loose skin and you may need a more comprehensive procedure. So now that you understand the three causes, skin laxity, muscle banding, and fat, let's talk about how we fix neck aging. The first step is always identifying what's actually causing the problem. That's why a consultation matters. In an evaluation, we look at your neck from multiple angles. We assess how much loose skin is present. We look for banding. We evaluate the amount and location of fat. We also look at the jawline and the chin structure because those affect how the neck looks in profile. Once we understand what's causing the aging, we can match the right treatment. If you have mild laxity and you want a small improvement, non-surgical tightening may be appropriate. If your main issue is fat under the chin and your skin is still elastic, liposuction may be enough. If you have significant loose skin, prominent bands, or a combination of issues, a neck lift is often the most effective solution. A neck lift can address multiple layers. It can tighten the skin, remove or contour fat, and remove excess skin. The goal is to restore a smooth neck, a sharper jawline, and a more youthful angle under the chin. And one of the most important things I tell patients is that a great neck results should look natural. It should not look overly tight. It should not look pulled. It should look like your neck did years ago, clean, smooth, and defined. Let's talk briefly about recovery because that's part of the decision-making process as well. After neck rejuvenation, especially surgery, swelling and bruising are normal. The first week tends to be the most noticeable. Many patients feel comfortable being seen socially within 2 to 3 weeks, depending on healing and the extent of the procedure. The final refinement continues over time as swelling resolves and tissues settle. So here's the takeaway. Neck aging happens because of skin laxity, muscle banding, and fat. Sometimes one, sometimes all three. And the best way to fix it is by identifying which is the factor that is driving the problem and choosing the right treatment. If you're bothered by your neck and you want to know what the best options are, the next step is a consultation with me. We'll evaluate your anatomy and create a plan that gives you the most natural, effective improvement so your neck matches how youthful you feel. So call us at 518-583-4019 or go to SaratogaSpringsPlasticSurgery.com.